Caring for your JP drain. A Jackson Pratt or a JP drain is a surgical drain placed near your incision to drain blood and fluid from the surgical site. This will help your incision heal. The drain works by suction from the bulb device. The tubing inside your skin has holes in it to drain the fluid from around your incision. I am going to show you how to milk the tubing, empty and reset the JP drain, measure the drainage, and how to clean around the JP drain. These are all the supplies you'll need to care for your JP drain. Alcohol sponge to strip the drain, container to measure the drainage, gauze and tape to change the JP dressing, a safety pin to attach the JP drain to your clothes, a belt to hold the JP around you while you shower. A mirror may also be helpful so you can better see your incision. You'll also need to write down when you emptied your drain and how much drainage you emptied. Emptying and resetting the JP. You should empty your JP every 8 to 12 hours. You can empty it more often if it gets full. When you empty your JP, you should first wash your hands and make sure you have a clean area for supplies. You may want to put a clean towel down to put your supplies on. It may be helpful to empty your JPs in front of a mirror so you'll be able to see the drain better. Stripping the drain. First, strip the tubing. Stripping the tubing prevents small clots from forming in the tubing and helps the JP to drain better. To strip the tubing, you want to start near where the tubing enters your chest. Hold the tubing between your thumb and finger. With the other hand, slide your thumb and finger down the tubing. Once you have stripped the tubing, you can then drain the JP. Emptying the JP. Uncap the spout on the JP. Squeeze the JP into the measuring container. There may be a little drainage left in the JP. That is okay. Now squeeze the JP bulb and replace the cap. The drainage in the JP will change from bloody to a watery pinkish red to yellowish as your incision heals. There may be some small clots in the drainage. If the drainage becomes cloudy or looks like pus, call your surgeon. This may mean you have an infection. It is important to treat infections early. Measuring the drainage. To measure how much drainage was in the JP, hold the container up to eye level and record the amount on the JP drainage record. Empty the drainage into the toilet. Rinse out the container with water and empty that into the toilet and flush. The amount of drainage will gradually decrease as your incision heals. It is important to record the amount of drainage from the JP so your surgeon will know when the drain is ready to be taken out. Showering with the JP drain. Your doctor will tell you if you may shower with the JP drain in place. If you may shower with the drain in place, you'll want the JP to be supported. You'll want to loop the JP through a cloth belt or shoestring and tie it around your waist. This will keep the JP from pulling on your side around the tubing. Be careful not to rub around the JP tubing with a washcloth or towel. Do not use any lotions around the JP tubing unless prescribed by your surgeon. Once you have showered, you can remove the old dressing. Changing the JP dressing. Cleanse around the tubing where it comes out of your skin with soap and water, unless your nurse or surgeon tells you to use another cleanser. Put a new gauze pad around the JP tubing and tape it in place. Pin the JP drain to your clothing to prevent pulling. The area right around the tubing may be pink. If you notice any redness, swelling, or drainage that is cloudy yellow, green, or pus-like, call your surgeon. This may mean you have an infection. The drainage record. Record the date, time, and the amount of JP drainage. Take the drainage record with you to your follow-up appointment with your surgeon. Caring for your JP drain. Remember to empty and reset your JP drain every 8 to 12 hours. Remember to record the amount of drainage in the drainage record. Remember to change your JP dressing at least once a day. Remember to take your JP drainage record with you when you have your follow-up appointment with your surgeon. Remember to call your surgeon if you notice any redness, swelling, or pus-like drainage at the JP site or in the bulb, or if you have a fever. Please call your surgeon's office if you have any questions or concerns.